I'm going to present results that we have obtained in the sprint project, and I'm really a talking head here. So whatever I'm going to say is going to rely on the work that my colleagues in the sprint project has produced, like Jose Luis Fernandez, Bent Greve, and Alexandra Lopez, and also Adam Richards, who's not here in the. So I will talk about tools for social investment in long-term care. And if we start from the central message of Sprint, social investment approach has considerable potential to enable decision makers to strengthen long-term care systems across the EU and thus help address the challenge of population aging. And of course the question is how can it be done? And in the Sprint project, we have developed various tools and methods that can be applied to achieve these goals. And my plan here is to give you an overview of those tools and also discuss some of the substantive issues that are involved with the application of these tools. So I will start with the following kind of framework. So in long-term care sector, we need various kinds of inputs like labor, capital, and material, and those inputs are being combined in order to produce outputs like intervention services and policies. But basically, we are not interested on those outputs themselves, but we are more interested in the final outcomes like the well-being and health of old care recipients. We are also interested in labor market outcomes of informal carers, and we are also interested in sort of macro level objectives like efficiency and equity of the resource use in the long-term care systems. So we can measure the cost of investments by measuring the value of inputs that we are using in the long-term care. If we are able to measure also the monetary value of outcomes, then we can start comparing costs and benefits and come to the conclusions whether the monetary return of investment exceeds the cost of investments, and we can start answering the question whether these investments have been worthwhile. So there are various steps that are needed to implement the framework in long-term care. I think it's a good idea to start with the definition of social investment in long-term care. I will spend very few minutes on this because it already appeared in Virginia's talk. We need to identify relevant stakeholders and also define outcomes of long-term care for each stakeholder. We need to develop reliable ways of measuring monetary value of outcomes. This can be a challenging thing. I will talk about that a little bit more. And we also have to deal with causal questions about the causal relationship between outputs and outcomes. And finally, we have to put everything together and start comparing costs and outcomes of long-term care investments. So here is the definition of social investment that we have developed in the Sprint project. And I think it's a sort of novel thing that we have produced in this project. It didn't appear in the literature before the Sprint project. And I'm not going to read it because Virginia already read it. But the definition gives us some kind of idea of the sort of interventions or services that we are interested when we are looking at the social investment in long-term care. But I will go to outcomes of long-term care services and start discussing about that. And as already definition of social investment sort of suggests, we are taking a very broad view to outcomes of long-term care in the Sprint project, and we are considering several outcomes for various stakeholders in the project. For example, if you think about old long-term care recipients, the use of long-term care services may affect the health and well-being of the care recipients. This is sort of expected. But also there may be some impacts or effects on the family members of old long-term care recipients. And we might see well-being effects for the family members because these family members have altruistic concerns for the health and well-being of close relatives. Informal carers are, of course, important stakeholders in the long-term care field. So the provision of informal care may have an effect on earnings of informal carers. It might also affect the health and well-being of informal carers. Actually, we know that there's a lot of evidence on this in the literature, and there may be also a risk of low income and pensions associated with the provision of informal care. And then care providers. When I talk about care providers, it includes a lot of things. I'm referring to local authorities, public and private providers in this case. So the provision of informal care, provision of long-term care might have an impact on the use and costs of other health and social care services, so that when people are receiving informal care and people are using home care, we might see a reduction in the use of other formal health and social care services like institutional care and maybe even healthcare services. So there may be so-called substitution effects available. And of course, we can also think that the monetary return that private providers are receiving is one outcome that we should consider as an outcome of long-term care services. Then a few things about the monetary value of long-term care outcomes. This has been a topic that we discussed a lot in the project. We spent a lot of time discussing about it, analyzing this topic, and this is what we came up in the Sprint project. So when you think about the long-term care outcomes, some of the outcomes are more readily monetized than the others. If you think about earnings of informal carers, for example, that is directly measured in the monetary units. So we don't have to worry about that. That's already measured in money units. But when we talk about health and well-being outcomes, then those outcomes are more challenging outcomes. And they don't really have a universally accepted methods to monetize at the moment. There are methods in the literature, replacement and friction cost methods. These are the cost-based methods. Stated and revealed preference methods are also there in the literature, and there is, I think the latest method is the well-being valuation method. What we have done in the Sprint project is that we are following the principles of social return of investment, which is basically using these same methods to value outcomes, and we have shown the potential to monetize the long-term care outcomes through illustrative examples. But we also emphasize the stakeholder involvement in the valuation of outcomes, because we sort of acknowledge that there may be a lot of variability in the valuation of outcomes across the stakeholders, and this variability should be taken into account. And we sort of think that the stakeholder involvement is the way to do this. So this is what we have produced in the Sprint project. Then a few words about measuring and finding causal effects. So basically we have a lot of ways of approaching this topic. We can do primary research, we can run randomized controlled trials that are sort of seen as the unbiased way of producing causal effects, but in the social care context they are often considered unethical, because the service allocation is typically based on the needs of service users. We can also do observational study or apply observational methods, but then we are confronting the question of potential selection bias, which is caused by the confounding factors. And I think we have to spend a lot of time with dealing with this selection bias. We can also apply the methods of qualitative research, as has been described by Richards in one of the Sprint deliverables. If there is a lot of evidence already in the literature, we can always do literature reviews, and that allows one to summarize the existing evidence. But the questions there are, of course, that we need to assess the quality of evidence. We can't be certain that the quality of evidence is always good. So that's one topic that we have to deal with. And the other one is that we have to ask whether the results generated in one country can be transferred to other countries. So if you have a lot of evidence from the United States, for example, on the effects of informal care, it's not necessarily the case that those results also apply in European countries. So this is one question that have to be dealt with. And then the comparison of costs and outcomes of long-term care. And what we have done in the Sprint project, we have developed a framework which we call impact map. It's really a framework and to bring together cost and outcomes and allow the comparison of cost and outcomes of long-term care services. And there are various steps that are needed to develop an impact map. We first have to answer the question, what is the need for long-term care? What sort of interventions are available to meet the need for long-term care? What evidence is available on the effectiveness of interventions? And we also have to measure the cost and outcomes of interventions. And then we need to start comparing benefits and costs. And of course, we have to deal with the question of how to monetize the outcomes of long-term care at this stage. And if we are able to do it, then we can start comparing cost and outcomes of different options available and find the sort of best available alternative or intervention available that can be where to invest the funding. With the Impact Map Toolkit, we have also produced a report that addresses the core issues related in understanding and developing an impact map. So basically, I'm coming to an end. I'm just showing our output. So here are the outputs that we have produced in the Sprint project. There's output on definition of social investment, definition of long-term care outcomes. We have 2 deliverables on principles and methods to value outcomes, and then there is an output on Impact Map Toolkit. In addition to these deliverables, we have also produced a practical tool that allows the comparison of costs and benefits of social investment in long-term care. And if you are interested in using that tool, it can be found from the Sprint website. Okay, so I think I'm done now.
Thank you very much, Ismo. Thank you very much.